Hey, what's up, everybody? This is Dr. Daniel Choi from North Texas Dental Surgery, Wisdom Teeth, and Denture Implant Center. And today I'm joined by my lovely treatment coordinator, Jackie.
Hi.
All right, so Jackie, unfortunately, we do have some patients sometimes. You guys ever watch that show Botched on TV, ETV, where basically patients have been botched in some sort of plastic surgery? And those doctors are amazing. Some of the
Yep.
work that they can do, but I look, I'm not a regular watcher like of that show, but
Same.
I have seen a few episodes where I'm just like, oh my God, it's like
Yeah.
amazing the results they get, right?
Mm-hmm.
But the reason why I wanted to start this video we have some patients unfortunately occasionally that get botched dentally, so they come
Mm-hmm.
to us to for a consultation, see if we can help them out. And we had a patient who was recently he had been botched over a period of. Can you tell a little
Yes.
story? So
So he did come in. He was very frustrated when we first met him. He pretty much telling the story. You can already see when he was sitting down there, he was getting kind of emotional in regards to like angry, just explaining himself. In regards to what brought him in to see us. His first thing was that he was very frustrated with just the process of all on fours. I know before he even started, the first thing he said was, "If I knew I was going to go through all this, I wouldn't have got the procedure done in the first place," which is sad because it's a great procedure. It gives people very good results, life changing results. So for him to regret that at the end was pretty sad to hear.
it is because we've seen tons of patients who come in
Mm-hmm.
upset about what their current aesthetics are. They're just feeling hopeless with their smile and everything, and they're just in tears afterwards, happy
Yeah,
tears, right?
happy
They're just
tears.
super
Yeah,
happy with the results, and then you can see, unfortunately, the other end of the spectrum, right?
right.
Patients who are in that
I'm
situation,
very
but
frustrated.
whether it's an all-on-4 or a snap-on denture. So basically, I just want to let you guys know we do have some photos and like I want to show you kind of like things in this video to watch out for, whether it's a snap-on denture, all-on-4, just stuff like that, because you're making a big financial investment, right? But I'm
Yep.
sorry, continue. Like, so what was his other issue?
His main concern was that he already put up a lot of money towards his
How
procedure.
much did you say he spent
Originally it was like 11,000. Then he
per
paid
arch?
per
So like
arch
22,
22.
then now
Then
we're
he paid
30.
additional, so now he's
Because
at
he got bait
30.
and switched,
Yep, he
right?
got bait and switched.
Common thing we see. So we'll try
Um,
to tell you guys some things to look out for too.
and he was a nice guy, so he wasn't upset about it. But I mean, he did get bait and switched. He did see that he had to keep paying for multiple visits. He had to come in multiple times. I know we did mention the 3D printing process that we go through at our office here. Unfortunately, the other office he went to, they don't have that option there. So he didn't understand the difficulties of coming in during the temporary phase of
Oh,
getting his denture
because it
fixed.
kept on breaking
It
on
kept
him.
on breaking on him.
Yep.
So he wasn't aware of that either until he was actually going through it. But once you're going through the process, you can't. What are you supposed to do at that point? It is what it
And he
is.
had failed implants.
Right, and he had
Yep.
failed implants, so he had to come in for multiple surgeries. He thought it was a one and done. He had to keep coming in for the same surgery, and then they are eventually he actually left with a traditional denture.
Right. So he was so frustrated, the doctor couldn't offer him a
Mm-hmm.
solution. He was just kind of left to hang in high and dry. And then basically, hate to say it, but he started looking for like
Other
legal
things,
help.
yeah,
Right.
legal help, just because he was so frustrated, and
Right.
he's a nice guy to add to that, because after all this, I don't know if I'd be so nice, but he was a really nice guy
Yeah.
after all of that too.
And the sad thing is, like, he couldn't even get a copy of his dental records, right? The,
Mm-hmm.
the doctor refused to give him his dental records. So, I mean, just
And
so
he's
many,
frustrated. Yeah, where's he
yeah,
gonna go now? Like,
felt
get
really bad
help.
for him.
Mm-hmm.
Okay, so let's basically show you kind of like what his case was like. Okay, so basically, I took a quick video with my iPhone. This was his denture that his dentist gave him to wear. Like, so after
Temporary.
the implants had failed, he had something screwed in, but they kept on failing on them and they kept on breaking, and also the implants were failing. So in the end, he gave him this, right? So, I mean, I
And he
don't know,
works.
like,
He works in sales, so like, imagine you like paying all that money, $30,000, and people ask you, "Oh, well, let me see your teeth," and that's what you have to show them.
right?
Like, it's embarrassing. He says he doesn't want to smile. He doesn't want to talk to people. He does recruiting, and it's just embarrassing, and it's sad because it's like I feel like as a human, like I don't know how I would walk around like that myself, and I'm a
Yeah,
female. He's a male, and he cares. So it's
right.
like I don't know. I'd be very frustrated as
How
well.
was how is that affecting in his business, right? Like if
How
he's
much money
not
he's lost from
lost the
not, yeah.
confidence and all that stuff, but like I mean, unfortunate. Like so, yeah, that's basically. And then let me show you some of the X-rays. So basically, here's his panoramic X-ray, but you could see that there's bone loss going on some of his implants. His lowers had actually integrated. I guess he had a previous implant that they hadn't removed, but his uppers just the all-on-4 just had significant amount of bone loss. And I'm not going to make this a video about what I think went wrong. I honestly couldn't offer my true commentary. I definitely think that he placed too large of an implant, which I could totally talk about in a different video where people just are obsessed about placing as large of an implant, but this guy has significant bone loss, so now he's unfortunately caught in a situation where it's going to cost even more money to fix this, right? So I don't want to make this a video about us, obviously I don't even want to mention the other doctor's name. But I don't want to like disparage anybody in this process, but how do we basically make a video that helps our patients avoid a situation like this? Because, I've been practice, I'm heading into my 12th year of practice now, and I've heard this from many patients over the years. I'm sure you've heard this
Mm-hmm.
comment, right? It's like, how am I supposed to know who's good, right? I'm investing a lot of money. Like, this is something that's very important for me. I'm looking for that aesthetic result. I want to chew, I want a combination of both, whatever it is. How do I know I'm going to somebody good? How would it,
And I'd be the same way if I'm spending all my money.
where do
Like,
you
how do
begin?
you know? Yeah, I don't
Yeah,
even like. I wouldn't know unless I worked here. I don't
right.
even know. You know. So
You
like,
you
you
can
don't
go
know till you know.
online, you see Google reviews, but honestly, like, you
That's
know,
all. You don't know if it's
you know,
real. You don't know if it's
exactly, right?
fake. You don't
Sometimes you
know.
just don't even know, right?
People ask if our reviews are fake all the time,
Right.
and I'm like, no. But you
Yeah,
get that question too. You don't know. You know.
exactly, right. Hey, we work hard for our reviews.
Yeah. Yeah.
We gotta make a lot of people happy.
Yep.
So anyways, like, so we compiled a quick little list to like really help maybe patients out, like in regards to like if a different part of the country, or if you're just looking, hey, how do I help somebody find a good dentist, right? So number one is credentials. When you're doing dental implants on fours, like they are not your standard dental implant. I will say that the people who are most typically highly trained in dental implants are going to be your specialists, right? So you're going to have your surgical specialists who are oral surgeons or periodontists. They get several years after dental school of just literally like surgical training, so
Mm-hmm.
implants, all that stuff. Why do credentials matter? Because in all honesty, with dentistry, like just like you saw in Botched, right? Like what Dr. Nassif and Dr. whatever his name is, but they'll say, "Hey, did you see a plastic surgeon?" Because there's cosmetic surgeons and there's plastic surgeons, right?
Yep.
And so like because it all has to do with training, right? So with dentistry, again, I'm not listen, I got tons of friends like who are general dentists placing implants. I'm not trying to say
Mm-hmm.
anybody is like anything negative about that, but we do see like we specialists are going to have more extensive training. Now, am I saying that general dentists can't place implants? No. Do I see some general dentists in my 11 plus years of practice like place amazing implants? Yes, I have. Absolutely. Dental implants, single implants, or versus like all on fours, there's a big difference, right? And how do you manage some of these surgical complications, all that stuff. So it does help to have a surgical specialist or like a dental specialist. Also, prosthodontists are great too. Hate to say this. This person, again, I'm not going to say names. This guy was a prosthodontist. And this case still got screwed up. So, okay, going on to number two, reviews, photos. So definitely a lot of photos would help. Like, let's see a lot of their work. Asked if you could see some of their previous work.
Some people,
Reviews,
and then also like people like that can relate to your smile too, because I know there's a lot of patients that have like a high smile line, and some people you can see a lot of their gums, some people you can't. So just being able to see like does this person actually fit with what I'm looking for, like just real life examples.
right? Reviews, I mean, that helps to a certain extent, right?
Mm-hmm.
Because
Yeah.
again, some people like, fake the reviews. Testimonials, that always helps. We had a patient recently, he did it all on four with us, probably like within the last 2 months.
Yes.
Um, he actually he actually spoke to some of our previous all on four patients, and that's how he decided to go ahead with us. In the end, he was very happy,
Mm-hmm.
but my goodness, he
He did a
was
lot of
like
research.
yeah, he's like a private
Oh
investigator,
yeah.
right? Like he wanted all the details. So you can always ask if they have any patients like that. Ask them how long they've been doing all on four, or snap-on dentures, right? There's a difference, right? And so I actually do want to show you two other quick examples. So here's a patient who had I actually made a YouTube video about this also in this case, and what happened to him, and I'll link it above so that you guys can check out that video, and we were able to help him out with an all on four. But he spent a lot of money. He wanted to do a snap-on denture. Unfortunately, it didn't reduce the bone enough, place the implant where it needed to be. The denture kept on breaking. It got to the point where he was actually using something industrial cement or glue in from his garage to keep his denture together because it kept on breaking because of the way that the dental implants were placed. So that was a quick little example. This is another case where a patient had mini implants placed for a snap-on denture. Jackie, can you tell us real quick about this case?
So this one was pretty sad as well. So he was a man that came in with his wife. She was making all the decisions for him because he did have dementia. So he came in for that the consultation, and he was confused as to why he was always not he wasn't able to eat, why his dentures didn't stay in place. He ended up being hospitalized many times because nutrition wise he wasn't getting the nutrition, he wasn't able to eat.
Plus post-surgical
Plus,
hospitalization because the
exactly,
dentist couldn't help him.
because the dentist couldn't help him. So she was just at loss of words.
She was angry,
Yeah, she was, yeah.
and she was taking it out on us.
I do remember that.
We were
I
trying
do
to help her
remember
out.
that.
Yeah,
She thought
but
because
she's
she didn't
really
know who to trust though.
the
You
great thing
know,
though is she's happy now. Yeah,
and she
but
didn't know
yes,
who to trust. So I
yeah,
mean, obviously, she just thinks like, like we're there trying to do the same thing for him too. So she was just making sure he got the best result because she doesn't want to see him go through that again, of course. So she actually went back to the doctor because we were able to help him in regards to eating and stuff like that. So he was actually happier with us, but he did go back to the office and she tried to get her money back, and
yeah.
again, she still didn't get much back from them. So it was a sad situation just because you could see like he just wanted to eat. He wasn't asking for aesthetics perfect. He wasn't asking for a smile be perfect. And they spent a lot of money, you know? So it's like he wasn't asking for anything. He just wanted to be able to eat again, and that wasn't even being able to be fulfilled. So I'd
Right.
be frustrated too, honestly.
Yep. So, and then one other example here. This is another patient had mini implants placed. And I'm, honestly, like mini implants are supposed to be a temporary solution. Do not even think about doing mini implants. You're just going to waste time and money. I can create a whole nother video about it, but these are one piece. You can't correct for angulations. These attachments can wear down. Your denture's not. Long story short, what's going to happen to you is that your prosthesis, your denture is not going to like stay in place and it's going to flop all over the place and you're going to be really frustrated. And the sad thing is that these patients are still spending over $10,000, a lot of money to get these done. So, they sound very exciting to patients because, it's more affordable versus what they thought they could have done. Maybe everybody wants like an all-on-4 or something, but they end up getting this and it ends up being a big disaster. That patient also, I was told he was hospitalized after his surgery because his dentist wasn't able to wasn't able to help him out. So, unfortunately, like I said, we do see a lot of cases where patients are already botched and then they've spent that lot money, they lost that money, and so they come to us like looking for a solution to help them out. So really like, what can we do? What's done is done. How can we prevent patients out there from like when they're doing their investigations to really help prevent them from getting in that situation? Now, I'll be honest, right? Like, so it's the elephant in the room. What really it comes down to is how people get botched is they look at cost,
Cost, yeah.
right? So I actually have a quick little example here for you guys. So here we go. When you guys are doing research online, whether you do all on four or Snap-on dentures, whatever you're searching for, you're typically going to see your ads up here, and these guys are going to be the ones that are going to be coming at you. They're paying for Google ads. They want to get your business.
Right.
And I mean, all on fours, for $11,000, I'll honestly tell you, like, we're not making any money if we're doing $11,000, right? So
Yeah.
there's just way too much like effort and risk when we're going ahead and like doing this massive procedure for you that we are following you over like 6 months. Um, to ensure that you have a good result. Like I know there's something going on with that, and of course, confirming our suspicions, it's a lot of bait and switching that's involved.
Mm-hmm.
So we've seen multiple patients, and that listing that you saw earlier does happen to be that practice where that patient came from for an insanely low price, and he was told that, and then got bait and switched, and then ended up spending more money. Implants failed, wasn't able to be helped out. Then he still wasn't given a solution, so he was given that denture we showed you earlier, and said, "Hey, like it's better that we head in separate directions." And basically, won't even give him his dental records, right? So
It's
that's why this patient
crazy.
found us,
It's
to
crazy.
be able to get some help. But when you guys are doing your research online, just be aware, like if you do see, like anything else in life, if you do see an obscenely low price, there's something probably going on there. And
Sure.
so, unfortunately, this is the case where when you guys are doing your research, hopefully, just to sum it up, like look for the credentials. Again, looking for a specialist would be even better. Reviews, photos, and again, not even specialists all the time. Like that, like it
Experience.
does help. Experience definitely helps,
Mm-hmm.
right? You want to see like a lot of reviews, photos, ask for testimonials, ask to see if they have another patient that can speak to you about their experience. Again, ask them not only how long they've been doing dental implants, but how long they've been doing all-on-4 snap-on dentures, all that stuff.
How many
Always,
cases do they do a month, or how many cases do they do a year?
right.
Stuff like that.
Avoid the bait and switch. Ask basically how they're gonna, like what's your follow-up process. Also be very wary of anybody that's offering to put you in a final prosthesis the next day or
Yeah.
48 hours. That's a big marketing draw. We're gonna give you your final solution within 48 hours because you don't want to mess with a temp or anything like that. And I'm gonna create another video basically talking about like, and I actually do have, I feel like I have videos talking about that. I'll link that also.
Mm-hmm.
But there's just beware of like these over promising you things because they're just trying to sell you something to give you
Yeah.
a quick solution, right?
Yep.
Do you want to get a house built in a month, and they're just slopping them up?
Yeah.
You're building a
Not
house for
long
life.
term.
Like
Yeah.
you're taking a 30-year mortgage on something. Hopefully you're planning on living there for a while.
It's an investment.
Exactly. So literally, this mouth, we get a lot. Even people in their 20s and 30s coming to us for long
Yeah.
fours, right?
That has to
So,
last them for
I
at
mean,
least
if
40
it
years.
is the only solution because all their teeth are bombed out and like it makes sense, then they're gonna do an all-on-4. But like we see people as young as that, but
Mm-hmm.
mostly people 40 and
40 and
up,
up. Yeah.
right? But they might be in that all-on-4 for another 30, 40 years. We are designing that to be lasting for like a significant period of time, so you can't just slop that together, right? So beware of like false like promises of super quick solution.
Mm-hmm.
Also, we were talking about it earlier in regards to one thing that people will like the almighty bait and switch is they're not telling them which final prosthesis they're
They're
going to
gonna
put them
get.
in,
Mm-hmm.
right?
Yep.
Like with that ad that we showed you earlier, that's basically for a temporary prosthesis, right?
But you don't know unless you know about the materials. You wouldn't know what's going on.
And do you want to is this acceptable in your mouth? Is it something that's constantly breaking, like that you have to go in every other week? Is that something that you're gonna like be okay with to save some money, right?
It's still a lot of money. So it's like,
Right.
I mean, like, and I don't think that's really aesthetics. I don't think that's gonna get you to where you want. It sounds good, but when you're going through that process, you're gonna get a little frustrated.
Right. And so, you're counting on that beautiful smile. And then the other thing that we want to talk about, like, is briefly, like, so for example, like whether you wanted your final solution to be like a zirconia prosthesis,
Mm-hmm.
right? I mean, the quality, like, I mean, we've seen some amazing, beautiful
Yes.
zirconias and we've seen some horrendous zirconias, right?
Mm-hmm.
So, again, like, don't be just, baited in by the price. It can, like a snap-on denture all on four, like, the quality of the denture teeth, like how well the fit is, everything. There's little nuances, and it's literally like a house. Like you can have a beautiful house that's, lipstick on a pig, which is just a lot of things going on behind the scenes that you don't know about,
Mm-hmm.
or you can have that beautiful house that was well constructed that's never going to give you any issues, right? And so
Yep.
usually, like how much you spend does have a little bit to do with it,
Yep.
right? And I think we do a really good job trying to give them
In
a really
between.
fair price
Mm-hmm.
and giving
And work with people. So I feel like
right.
yeah, we do a really good job with that.
Is there any other thing that we could recommend for the patients in regards to things that you look for? I mean, you're the person that talks to them all the time,
Um.
right? So
Hmm. I think majority of the questions that I do get in consults is they'll come in with different ads online saying, well, how come they're charging this and you guys are charging this? It's the same procedure, it's the same material.
right,
It's not. So trying to explain that to them without them, because they're being told one thing and I'm trying to explain to like exactly what they're being told. They can see the differences and why, like the price. There's a price difference. Also, what they were told is not going to last them long term. Because many people are like, well, I want to be able to eat corn on the cob or steaks or apples. Like that's like the main foods they want to be able to eat again. And they were told with like a denture that you've seen before that they're going to be able to do that with that denture. And if you don't know, that sounds great. You know, like obviously I'd be like, oh yeah, I can eat everything with that denture. You don't know.
Can I let's on that topic,
Mm-hmm.
right? Let me show let's show them something real quick. So here's a patient who had all on four done years ago. She had a hybrid prosthesis, meaning it was a titanium bar with a acrylic teeth baked on top. And she had this. She paid another $3,000 like 2 years ago to basically have the acrylic and the teeth redone, and that tooth broke off, and that's how she met us. Like she came into our practice, like looking for a solution because the tooth kept on breaking off, and then we inevitably told her like, hey, we can't do anything other than basically make you another prosthesis,
Mm-hmm.
and we did it on the cheap. We actually we didn't even make any money off of it. We were just trying to help her out. She's like in her 80s, and anyways, she was pissed.
Very.
She was frustrated. She was like, "This is ridiculous. I spent $25,000 years ago for an all-on-4."
Thought I was done.
Yeah.
I
Then
never
she
missed it again.
right. Then she had like a hybrid, like titanium prosthesis with the acrylic teeth baked on.
Mm-hmm.
But that's what can happen with these. These teeth can break off. And then she spent another $3,000 2 years ago.
To get all fixed again, all
Yeah.
baked back on again.
Yep. And then basically the tooth broke off. And then so she's like, it's like the only thing that we can do to fix this is go to a one piece unit where your teeth aren't going to break off, right? And so, long story short, she was frustrated. She's in her early 80s. She doesn't have a lot of money. And so, we literally did it at cost for her to help her out. But, anyways, these are just situations. Why I bring this case up is that we have like people that are being bait and switched for something that's like, hey, like, let me draw you in with this cheapest price where I don't even offer that solution because I know that it's going to cause problems later on down the road. And patients are going to get frustrated by it,
Yeah, and so we're gonna come back in for multiple visits, and I know they're not gonna want to fix this every 2 weeks.
Exactly.
You know, like especially for vacation. Imagine she was going to like Disney World or anything with her trips, which she was actually. So she actually, the first time she came in, she couldn't come back in for us to fix the denture because she wanted to go see her grandson for an event, I believe it was. So it's like, what? And then it broke off again because we kept telling her like, we're gonna have to fix it, like give you a whole unit.
Yeah.
So it's frustrating, especially if you're trying to eat, you're trying to smile, you already spent that much money. It's embarrassing, especially as a female. So I understood her frustrations for sure.
Right, right. And so, unfortunately, sometimes people get really frustrated at us because they're their previous experiences.
I don't get offended anymore.
Yeah, exactly. I mean, you get it, right?
I know you're frustrated.
Right.
I would be the same way, so it's okay.
And we help them in the end. They're happy in the end. But
then we get hugs.
Yeah. But yeah, I mean, that's just like another bait and switch, right? So, unfortunately. So, anyways, hopefully this information was helpful. We don't want anybody getting botched. We don't want anybody to go through that frustration. And so we do have a bunch of other videos. Feel free to go over them, and you can learn a lot about snap-on dentures or all-on-fours. Kind of learn basically how to find, like have the procedure done well. And honestly, I've had patients that like literally watched every single video, and like there's nothing to even explain. I mean, like I almost feel like they can do the surgery themselves.
Yeah, literally, they come and they're like, I already know Dr. Choi, and I'm like, you do? Like all the videos, so
yeah,
definitely check out those videos for sure.
Yep,
you'll learn a lot.
Well, I hope that information was helpful for you guys, and we look forward to seeing you soon. If you guys have any questions, please feel free to leave a comment below.
Thumbs up.
Yep, give us a thumbs up. Hit the alarm bell. I guess you get notifications. I hear that. Like how awesome is YouTube? You know how many gardening videos I've watched?
Oh my gosh. Okay. Not the gardening.
I got a full blown garden bed. Like 7 garden beds in my backyard. I'll save that for another video. Maybe one day.
Your whole 30, 45 minute video.
Yeah, maybe one day I'll show you guys my backyard. Yeah.
Way more interesting than implants.
Yeah. All right. Thanks. We'll see you later. Bye.